Hello everyone, welcome back to the channel English Doctors. Today we will learn about the anti-diarrheal drugs in a very simple method. By the end of this video, you will be able to learn what are anti-diarrheal drugs, how they work, when they should be used, and their important side effects. So let's get started. First point, what are anti-diarrheal drugs? These are medicines used to treat the symptoms of diarrhea or slow motion. When food moves slowly inside the large intestine, the body has more time to absorb water and the stool becomes harder and the symptoms of diarrhea become less. Number 2, when should be these medicines used? Usually used for mild to moderate diarrhea. These are also used in some people who have chronic diarrhea due to irritable bowel syndrome. When should these medicines not be used? These medicines should not be used in high fever, bloody diarrhea, severe bacterial infection, or the signs that show that the infection has spread throughout the body. Why? Sometimes the diarrhea removes the harmful germs from the body, and when you stop the diarrhea, the germs remain inside your body and make the problem more worse. If diarrhea becomes more severe after taking these medications, they should be stopped and the patient must see a doctor. Examples of anti-diarrheal drugs: mostly opioids agonists are used, and their 3 examples will be discussed here. First, Loperamide. Loperamide is most commonly used as anti-diarrheal drug. It is available without any prescription in many countries. Actually, it is an opioid agonist and have no analgesic action because it can cross the blood-brain barrier to reach the brain, due to which it only acts on the intestine to decrease the gastric and intestinal motility, to increase the transit time and absorb more water from the stool and make it harder, and the symptoms of diarrhea becomes less. Its dose is 2 mg 1 to 4 times per a day. Second, Diphenoxylate. Unlike Loperamide, it is a prescription medicine. At normal dose, it only works in the intestine, but at higher dose, it crosses the blood-brain barrier and reaches to the brain and causes the symptoms like sleepiness, dizziness, central nervous system effects, and opioid dependence if used for a long time or at a high dose. To prevent misuse, manufacturers add a small amount of atropine. This atropine causes unpleasant symptoms if someone takes much more and in a high dose of this medicine. Atropine may also help to reduce bowel movement by decreasing the intestinal motility due to blocking the acetylcholine or cholinergic activity in GIT. Side effects of diphenoxylate are constipation, dry mouth, blurred vision, sleepiness, dizziness, fast heartbeat, and difficulty passing urine. It is also a prescription medicine mainly for those patients having IBS with diarrhea. It works mainly by activating the opioid receptor in the intestine and slow down the bowel movement to increase the transit time for the more water absorption and making the stool harder to decrease the diarrhea symptoms. At normal doses, 75 to 100 mg twice a day according to the condition of the patient or doctor advice. This drug must not be given to patients who have history of alcoholism, pancreatitis, disease of sphincter of Oddi, and patients having no gallbladder after surgical removal of gallbladder. Thank you for watching. If this video is helpful in understanding the anti-diarrheal drugs in a simple way, then like, share and subscribe our channel.